Exemplar, 13G spinal cord injury. Concept, mobility. O. Concept definitions. Mobility refers to purposeful movement, including gross simple movements, fine complex movements, and coordination. Immobility and inability to move. Impaired physical mobility, a state in which a person has a limitation in physical movement but is not immobile. Broken arm. Deconditioned, a loss of physical fitness, patients that have been in bed for a long time. Mobility. Mobility plays an important role every day. Determines how we move and function. Interferes with ADLs, showering, getting dressed. Work environment. Nurse, you can't work with a broken leg. Home environment. How are you going to get up and down the stair? Sports. Can't play soccer with a broken leg. Fun and recreation. Driving, being able to get there. Interactions with others. It can be isolating.
Complete partial mobility, complete fu.
Immobility, mobility. Mobility and immobility may refer to a particular part of the body, or they can refer to the entire body. Prevent breakdown of the skin. Range of motions. Getting out of bed, help drain secretions, open up lungs, prevent DVT. A lot of hospitals don't have good physical therapy programs or understaffed physical therapy programs, and so in these cases, it really does fall back on the nurse. Immobility can lead to delirium. It can lead to a lot of complications and increased lengths of stay. Make sure that patients are as independent and mobile as possible, but also that we're providing enough help that they're safe. Physiological process. Optimal mobility relies on bones, joints, articular cartilage, tendons and ligaments, skeletal muscle, and the mechanics of muscle contraction. Neurological system. Signals for all movement are communicated to and from the brain through nerve impulses. Motor cortex, frontal lobe, spinal cord, peripheral nerves, targeted muscle, cerebellum, is all about balance. Musculoskeletal system. Bones, structural foundation, supports and protects, and provides attachment sites. Joints, provide stability and allow skeletal movement. Muscles, under voluntary control, any of these are compromised, mobility will compromised. Consequences of impaired mobility. Attaining and or maintaining mobility is paramount to health. The human body was designed to move, thus, when movement is limited, consequences occur. Cardiovascular complications, central and peripheral perfusion. Lack of physical activity equals decreased cardiac capacity. Respiratory complications. Physical activity equals full lung expansion. Respiratory failure, RF reduced lung expansion, atelectasis, reduced capacity for gas exchange, PNA pneumonia. Integument system. Sustained pressure on the skin reduces perfusion to the tissues equals hypoxemia equals increased risk for skin breakdown. GI complications, constipation. Urinary complications, renal calculi, urinary stasis, and infection. Psychological effects, boredom, depression, feelings of helplessness, hopelessness, grieving, anxiety, anger, disturbed body image, and decreased verbal nonverbal communication. Body system. Cardiovascular system. Effects of immobility. Increased cardiac workload. Increased risk for orthostatic hypotension. Increased risk for venous thrombosis. Respiratory system. Effects of immobility. Decreased depth of respiration. Decreased rate of respiration. Pooling of secretions. Impaired gas exchange. Gastrointestinal system. Effects of immobility. Disturbance in appetite. Altered protein metabolism. Altered digestion and utilization of nutrients. Decreased peristalsis. Urinary system. Effects of immobility. Increased urinary stasis. Increased risk for renal calculi. Decreased bladder muscle tone.
Musculoskeletal system.
Effects of immobility. Decrease muscle size, tone, and strength. Decrease joint mobility, flexibility. Bone demineralization. Decrease endurance, stability. Increase risk for contracture formation. Metabolic system. Effects of immobility. Increased risk for electrolyte imbalance. Altered exchange of nutrients and gases. Integument. Effects of immobility. Effects of immobility. Increased risk for skin breakdown and formation of pressure ulcers. Psychological well-being. Effects of immobility. Increased sense of powerlessness. Decreased self-concept. Decreased social interaction. Decreased sensory stimulation. Altered sleep-wake pattern. Increased risk for depression. Risk for learned helplessness. Assessment. History. Past health history. Medications: drowsiness, dizziness, orthostatic hypotension. Surgery treatments: surgery on their hip. Are there limitations to what they can do or restrictions to things? Social history: presence of pain with movement. Recent changes in mobility or problems with balance. Presence of fatigue. Recent falls. Recent changes in ability to complete ADLs. Assessment. Examination findings. Size, symmetry, and strength of muscles, 0-5 scale. One calf's much bigger than the other, and not because of DVT reasons, but because of atrophy. OM of joints. ROM of joints. Gait and body posture. Standing up tall, that they have that core muscle strength that they can use. Diagnostic tests. Bone density test. X-rays. CT scan. Blood work for calcium levels. Laying in bed demineralizes the long bones. Calcium is released into the bloodstream. A high calcium might be an indication that they're not moving a lot. Neurological assessment. Interview. Vital signs. Level of consciousness. Pupillary assessment, size, shape, reactivity. To light, comparison of one pupil to the other, that could be a sign of altered intracranial pressures. Motor function, 0-5 scale, you want to make sure that they can move all of their extremities. Sensory function, bad neuropathy and they can't feel their left foot, they may not be able to stand or walk on it correctly. Muscle tone. Clinical management. Primary prevention, regular physical activity, optimal nutrition, keeping an ideal body weight, and adequate rest. Secondary prevention, screening, osteoporosis and mobility screening and fall risk assessment. Collaborative interventions, physical therapy, pharmacologic agents, surgical interventions, medium knee replacement or a hip replacement, immobilization during traction, and assistive devices. Do they need a cane at home? They need a cane at home. They're going to need a cane in the hospital, and they use a walker wheelchair. Interrelated concepts. Gas exchange. If they're not ventilating well, then they're not going to get very far. Intracranial regulation, nutrition, pain, perfusion, tissue integrity, and elimination. Sammy Sanchez. Effects of immobility. 34-year-old patient with a spinal cord injury secondary to an MVA. Patient is a new paraplegic with the accident occurring approximately 1 month ago. MD placed an order for patient to get out of bed, OOB to chair with mechanical lift, but patient is refusing. Patient has developed a stage 3 on his coccyx and just wants to be left alone. What are Sammy's obstacles to mobility? Spinal cord injury, pressure injury, motivation, embarrassment, depression, support system, fear. What? Op- obstacles. What can you, as the RN, do to overcome those obstacles? Patience, education, connecting with him, positioning, psych consult, encouragement, getting family support. Ways to mobilize.
SAMMY.
Active ROM, putting him in wheelchair. Passive ROM, repositioning, encourage mobilization. Trapeze, compression stockings. IS,